Warning! Watch this video or you will regret it. Without warning bells, without clear signs, stroke still silently stalks the elderly every day. In just a split second, a healthy person can fall into a coma, become paralyzed on one side, or lose the ability to speak. For the elderly, stroke is not only a dangerous disease, but also a fateful turning point that completely changes their lives and their families' lives. Today's video will help you understand why strokes occur more often in old age, how dangerous they are, and how to prevent them properly. What is a stroke? A stroke, also known as a cerebral stroke, occurs when blood flow to the brain is suddenly interrupted. This causes brain cells to lack oxygen and die within minutes if not treated promptly. There are two main types: cerebral infarction, accounting for about 85%, due to a blood clot blocking a blood vessel. Cerebral hemorrhage. Due to a ruptured blood vessel, blood spills into brain tissue. In the elderly, blood vessels are weak and the vessel walls are atherosclerotic, so they are easily ruptured or blocked. It is worth noting that strokes do not occur randomly, but are often the cumulative result of many chronic diseases, especially high blood pressure, diabetes, and high blood fat. The problem is that the elderly often take lightly transient dizziness, mild numbness in the limbs, or temporary stuttering because they think that these are normal signs of old age. But these can be warnings of a major stroke. Why are the elderly susceptible to stroke? As age increases, blood vessels also age, lose elasticity, become easily hardened and narrowed. In addition, risk factors such as long-term high blood pressure causes high blood pressure, damaging the vessel wall. Diabetes damages small blood vessels. Dyslipidemia causes atherosclerosis. Sedentary lifestyle, high-salt diet, low green vegetables, long-term smoking and drinking habits. In addition, hormonal changes, blood clotting disorders, or dehydration due to drinking little water also increase the risk of stroke in the elderly. In addition, cognitive and reflex decline makes the elderly unable to recognize symptoms and cannot call for help, making the chance of survival even lower. Warning signs. Don't ignore every second stroke comes very quickly, but there are still early warning signs. If you are observant, your family can save your life. Distorted mouth, slurred speech, or inability to speak. Blurred vision, temporary loss of vision on one side. Weakness and numbness in the limbs, especially on one side of the body. Severe dizziness, unsteady walking, loss of balance, sudden, severe headache. The FAST method helps to quickly identify. F. Face. Is the face crooked? A. Arms. Can you raise your arms normally? S. Speech. Is your speech clear? T. Time. Call an ambulance immediately if there are any signs. Time is brain. Every minute that passes, millions of brain cells die. Emergency care in the first 3 to 4.5 hours is the golden time to save lives and reduce complications. Severe complications after a stroke. Surviving does not mean living. A stroke not only threatens life, but also leaves behind severe complications, especially in the elderly. Many people are lucky enough to survive, but have to face a life of complete dependence, pain both physically and mentally. The most common complication is hemiplegia, or paralysis of the whole body. This makes it impossible for the patient to walk, clean themselves, or eat without assistance. When lying down for a long time, they are also susceptible to bed sores, pneumonia, urinary tract infections, complications that can lead to secondary death. Many people after a stroke also lose the ability to speak or understand what others say. The reduced ability to communicate makes them feel isolated and alienated. Some others suffer from memory loss, disorientation, and even no longer recognize loved ones. This increases the risk of depression, changes in personality, causing the patient to withdraw and lose connection with the world around them. Even more frightening, the recovery process after a stroke is very slow and rarely complete. Elderly people are already in poor health and often have many underlying diseases. So recovery is almost a luxury. They have to depend on relatives, lose the ability to care for themselves, and lose both confidence and dignity. Stroke prevention. Reduce risk. Today, don't wait until tomorrow. Stroke often comes suddenly, but its risks are not uncontrollable. For the elderly, prevention is not only about reducing the risk of stroke, but also about protecting life, mobility, and dignity at the end of life. First, it is necessary to control the highest risk factors, such as high blood pressure, diabetes, blood fat, and cardiovascular disease. These are the silent accomplices that cause damage to the brain's blood vessels. Regular blood pressure measurement, blood sugar testing, and blood fat testing at least every 6 months are necessary, especially for people over 60 years old. Diet also plays an important role. The elderly should limit salt, sugar, and fat, increase green vegetables, fish, whole grains, and drink enough water. Avoid salty foods because salt increases blood pressure, the leading cause of stroke. In addition, it is necessary to maintain gentle daily exercise. Walking, Tai Chi, yoga for the elderly. Physical activity helps blood circulate better, reducing the risk of blood clots, the main cause of stroke due to cerebral embolism. Another factor that is often overlooked is sleep and spirit. Elderly people with prolonged insomnia, stress, or depression are also prone to endocrine disorders, causing irregular blood pressure. Families should pay attention, create a happy, connected atmosphere, help the elderly live positively, and stabilize their emotions. Stroke does not choose people, does not make an appointment, and does not give anyone a chance to prepare. For the elderly, each dizziness, each moment of numbness in the limbs can be a silent warning of an impending disaster. The sad thing is that when a stroke occurs, not everyone survives, and if they do, few people live a full life. Therefore, do not wait until you are bedridden to learn how to take care of your health. Starting today, start with small things. A healthy meal, a slow walk, a blood pressure check. Being proactive today is the most precious gift you can give yourself and your loved ones.